In everyday English, we have this really comforting, predictable system for dealing with multiples, you know?
Oh, absolutely. It's so simple.
Right. Like if you have more than one of something, you literally just slap an "es" or an "es" on the end of it. It's
Yeah.
basically mathematical.
Right. One card, two card.
Exactly. One arm, two arms, one bone, two bones. It's clean, it's binary, and you never have to think about it.
Until you do.
Yeah, until you step into a hospital or like you open up a medical chart
Yeah.
because that reliable little machine completely breaks down.
It really does. It is the absolute definition of diagnostic muddy waters,
Yeah.
at least from a grammatical perspective.
Yeah.
Because suddenly you don't have two vertebrae. You have vertebrae.
Right.
And one bacterium
Okay.
doesn't become bacteriums, which would be nice and easy.
Yeah.
It becomes bacteria.
Yeah, and if a doctor gives you more than one diagnosis, you don't get diagnoses, you get diagnoses. Which, I mean, it feels entirely arbitrary until you actually look under the hood. So for you listening today, we are opening up this massive dossier of sources to explore this hidden, slightly maddening linguistic landscape.
It's a deep one for sure.
Oh, it really is. We've compiled these comprehensive breakdowns of medical terminology, historical style guides, major anatomical reference texts.
A lot of heavy reading.
A ton. But our mission for you on this deep dive is to essentially hand you a literal decoder ring for this language.
I like that. A decoder ring.
Right. Because we aren't here to just, memorize dry grammar rules. That's boring. We want to unpack why doctors actually speak the way they do, how this ancient framework actively shapes modern clinical outcomes, and honestly just give you a shortcut to sounding incredibly well-informed the next time you're sitting in an exam room.
Well, what's fascinating here is that medicine didn't actually invent these complicated rules.
Oh, really?
No, it inherited them.
Yeah.
We're talking about a vocabulary that was borrowed wholesale from classical Latin and ancient Greek. Yeah, stretching back up to like 2,000 years.
That's wild.
And rather than being anglicized,
Yeah.
rather than adapting to our standard modern English's rule, these words just stubbornly kept their foreign plural patterns.
Okay, let's unpack this because it feels like trying to run, 2,000-year-old Roman software on a modern English operating system.
That's a great way to put it.
Right, like the code doesn't format correctly, so we get all these weird glitches where an eddas just won't attach to a word.
Yeah, the system rejects it.
Exactly. So how did this linguistic time capsule actually survive into the 21st century? Because, my doctor's using a digital tablet and AI-assisted imaging, but they're writing notes using grammar from the Roman Empire.
It's a wild juxtaposition.
Yeah.
So to understand the survival of that legacy software, as you call it, we have to look at how medical knowledge was traditionally preserved.
Okay.
Because there is no single architect of these rules. They predate medicine as a formally regulated global discipline.
So nobody sat down and wrote the official medical dictionary back then.
Right, exactly. They stem from two massive distinct traditions. First, you have the Greek foundation.
The Greeks were huge on this, right?
Massively. This clinical knowledge was compiled in the Hippocratic corpus back in the 5th and 4th centuries BCE.
Wow. So way back.
And then later, it was systematized by this incredibly influential physician, Galen of Pergamon, in the 2nd century CE. So Greek was sort of the original language of advanced anatomical observation.
Okay, but the Romans eventually, they take over the geopolitical landscape.
They do. And the most famous codification of Roman medicine is this massive encyclopedic work called De Medicina.
De Medicina.
Right, written by Aulus Cornelius Celsus around the year 25 to 35 CE.
Okay.
And Celsus wrote in Latin, obviously.
Yeah.
But he heavily borrowed the Greek medical terms that were already circulating.
Because the Greeks had already figured out the concepts the Romans hadn't even mapped yet.
Exactly. Why reinvent the wheel? Right.
So modern medical English is basically this patchwork quilt of these two ancient empires.
Basically, yes.
You've got Greek roots like gestar for stomach or itis for inflammation, and they're sitting right next to Latin words like vertebra or corpus. They're just stitched together.
Stitched together is right. And this hybrid language created a massive bottleneck as time went on.
How so?
Well, for centuries, European medical schools were operating in these isolated silos, speaking this informal, very inconsistent hybrid Latin.
Ah.
So a student trained in Paris might use a completely different Latin or Greek plural than a student trained in Vienna.
Oh, that sounds like a mess.
A total mess. And by the late 19th century, medicine was, modernizing rapidly. Germ theory was taking hold. Surgical techniques were advancing.
Right, and medical journals were finally being published internationally.
Exactly.
But communication must have been just an absolute nightmare. I mean, if you're a surgeon in London trying to replicate this groundbreaking procedure developed by a surgeon in Switzerland, and you can't even agree on the plural noun for the blood vessels you're supposed to be cutting. That's not just annoying, that is a life or death translation error.
And that practical crisis right there is what forced the medical community to finally standardize the code.
They had to fix it?
They had to. So in 1895, this international committee gathered in Basel, Switzerland, to create the Basel Nomina Anatomica.
Sounds very official.
It was. It was the first serious attempt to establish a single, universal Latin naming system for the human body.
Okay.
And crucially, they didn't just standardize the root words, they explicitly codified the grammatically correct classical plural forms.
So they essentially locked the legacy software into place.
They codified it forever.
Yeah.
And that 1895 effort evolved over the 20th century into what is now the modern authority, which is the 1998 Terminologia Anatomica,
Okay.
published by the Federative Committee on Anatomical Terminology.
Yeah, wow, that is a mouthful.
It is, yeah. And they also maintain companion guides for histology and embryology. So the real book we use today is actually a modern international invention, even if the grammatical mechanics themselves are ancient.
So just to bring it back to you listening, this wasn't just some pedantic grammar exercise by a bunch of academics sitting in a room.
Not at all.
This standardization project solved a massive global communication failure.
Absolutely.
So now that we know who wrote the rulebook and why, let's look at the actual mechanics of this language, because our sources break this down into a system of basically ending swaps.
Right, based on the noun's original class.
Yeah, what linguists call its declension.
Yep.
Let's run through the big 5 rules and see how they actually function in a clinical setting. Let's stress test this vocabulary.
Let's do it. So let's start with the foundation. Classical Latin and Greek were inflected languages.
Which means what exactly?
It means the ending of a word actually changed based on its grammatical role in a sentence, its gender, and whether it was singular or plural.
Okay, got it.
So the first major pattern, the first declension, applies to Latin feminine nouns ending in A.
Okay.
To make them plural, the A drops off and becomes A.
Okay, this is the famous vertebra to vertebrae shift.
That is the absolute textbook example.
Yeah, because every medical student learns that the human spine is composed of 33 individual vertebrae.
Exactly.
Let me actually pull the breakdown from our dossier here. Yeah, it's 7 cervical in the neck, 12 thoracic in the upper back, 5 lumbar in the lower back, plus 5 fused into the sacrum, and 4 fused into the coccyx.
Yep, that's the 33. And that grammatical rule, it applies across the board for these feminine Latin nouns.
Okay.
So, for example, a single fluid sac cushioning a joint is a bursa.
Okay, so collectively they are bursa.
Right. And connective tissue is fascia.
So plural is fasciae.
You've got it.
Okay, I am starting to see the architecture here. Feminine A words swap to AP. But what happens when we encounter a masculine word?
Good question.
Like, let's say a word ending in AS. The A swap wouldn't apply there, right?
It wouldn't, because masculine nouns ending in us fall into the second declension.
Okay, completely different bucket.
Exactly. And the plural mechanism here is to drop your us and just add an I.
Right.
The most striking anatomical example of this is alveolus to alveoli.
Right, those are the tiny air sacs in the lungs where oxygen and carbon dioxide are exchanged.
Yes. And the scale of that pluralization is staggering.
Oh, I bet.
There was a landmark 2004 serological study by Ox and colleagues, and they estimated that the average adult human lung contains roughly 480 million alveoli.
480 million.
Yeah, that's a lot of eyes.
That is absurd. Other common examples of this osteoswep would be like fungus to fungi, right? Or bronchus to bronchi.
Exactly. Or the nucleus of a cell becoming nuclei.
Nuclei, right?
Right.
So we have feminine and masculine Latin covered.
Right.
But I'm looking at a word like diagnosis. It ends in S. It doesn't fit into the A or the uses buckets we just defined.
Because that brings us to a completely different branch of the linguistic tree.
Okay.
Words ending in E's generally follow the third declension pattern.
And what does that do?
They shift to E. So a single diagnosis becomes multiple diagnoses.
Diagnoses. Okay.
And this specific vowel shift, it actually carries immense clinical weight.
Really? Just the vowel?
Oh, absolutely. Think about oncology. A single secondary tumor site is a metastasis with an E.
Okay.
But if the cancer spreads to multiple locations, it is charted as metastases with an E.
Wow. That one tiny vowel shift completely alters a patient's reality.
It changes the entire trajectory of care.
That's heavy.
Yeah. The staging frameworks, like the T&M classification system for solid tumors, they hinge on this exact grammatical distinction.
Really?
Yeah. The patient's prognosis, their eligibility for certain clinical trials, the aggressiveness of the treatment plan, literally everything pivots on whether a radiologist dictates metastasis or metastases.
The grammar is literally encoding the severity of the disease.
It really is.
That's wild. Okay, let's move to the fourth rule, which deals with neuter nouns. If a word ends in the Greek on, or the Latin it pluralizes to an a.
Correct.
So a single ganglion becomes ganglia, or an atrium in the heart becomes atria. But the most famous example here, and one that I think trips up almost everyone outside of a laboratory, is bacterium to bacterium.
Oh, it is arguably the single most violated rule in casual English.
100%.
You constantly hear people say, like, the bacteria is resistant to antibiotics.
Right, but saying the bacteria is grammatically identical to saying the geese is.
Exactly.
Because bacteria is already plural. We're treating a plural word as a singular entity.
Right. If you isolate one single organism under a microscope, you are looking at a bacterium.
Bacterium.
If it's a colony, the bacteria are.
The bacteria are.
And this neuter to a rule has serious surgical implications too.
Oh, like with the metastases.
Yeah. Take the word diverticulum, which is just a single small pouch that can form in the lining of the digestive system.
Okay, so if a gastroenterologist finds just one diverticulum during a colonoscopy, they note it, but it might not be a major concern, right?
Right. But if they find diverticula, the plural, that indicates a condition called diverticulosis.
Ah, I've heard of that.
Yeah, and that dictates entirely different dietary recommendations.
Yeah.
It carries a risk for severe inflammation or even surgery. So that A ending communicates a systemic issue rather than just an isolated structural quirk.
It's amazing how much data is packed into a single letter. Okay, the final of the big five rules from our sources deals with words ending in X or nings.
Yeah.
These swap to ices.
Correct.
So the cerebral cortex becomes the cortices, your appendix becomes appendices.
Exactly. That basically sums up the primary structural rules the 1895 committee locked in.
But here's where I want to push back a little bit.
Okay.
Because if we have these rigid, mathematically precise rules, if we have a literal dictionary of declensions, doesn't that imply a flawless system?
You would think so.
Right. Like if I see a medical word ending in ahus, I should just confidently change it to I. Right.
You'd think so, but that is a massive linguistic trap.
Wait, really?
Oh, yeah.
Yeah.
The is to I rule only applies to second declension masculine nouns.
Only second declension.
Right. There are neuter nouns that also happen to end in I's, but belong to a different declension entirely.
Oh, come on.
Yeah, and they don't take an I, they take era or aura.
Wait, give me an example of an SU word that doesn't become I, because I'm trying to picture this.
Okay, think of the Latin word corpus, meaning body.
Okay, corpus.
If you follow the false assumption, you would say the plural is corpi.
Which sounds wrong.
Because it's actually corpora.
Oh. Corpora.
Yeah. Or take viscus, the term for an internal organ.
Okay.
The plural isn't visci, it's viscera.
Ah. Viscera. I know that word from, like, crime shows and surgical dramas. I just never realized it was the literal plural of viscous.
Most people don't. The operating system glitch here is that you can't just look at the last two letters of a medical term and guess the plural.
No, clearly not.
You have to know the word's underlying Latin or Greek lineage to know how it actually behaves.
Which perfectly demonstrates that language, no matter how hard an international committee tries to nail it down, is inherently messy.
Very messy.
So let's look at the rebellions. Where else do these rules completely fall apart?
Well, anatomy instructors constantly have to warn their medical students about the NX trap.
Ah, because words ending in X look dangerously similar to the X, and X words we just established become ices.
Exactly. Writers see an X at the end of a word like larynx, and their brain automatically tries to apply that fifth rule.
So they want to write laryntices.
Right. But words ending in X are overwhelmingly Greek in origin, and they take a completely different path.
Okay.
They become enges.
So larynx becomes larynges.
Yep. And pharynx becomes pharynges. But the most crucial one for orthopedics is phalanx, a single bone in your finger or toe.
Oh, right.
The plural is phalanges. And writers, And honestly, sometimes even clinicians constantly invent non-standard forms because the Greek rule just feels so unintuitive.
Yeah, it doesn't sound right to an English speaker. Let's talk about the clinical stakes of messing that one up, though.
It can be bad.
Yeah.
Imagine a radiologist dictating a rapid-fire voice report for an emergency room.
Okay.
If they stumble and misuse the singular phalanx when they actually meant the plural phalanges,
Oh, wow.
yeah, the attending ER doctor reading that transcript might interpret a massive crush injury involving multiple fractured fingers rather than just an isolated break on one digit.
Because grammar dictates quantity, and quantity dictates the trauma response.
That's
But
right.
sometimes the medical community itself just quietly decides a classical rule is too absurd to maintain, right?
Oh, for sure.
Because our sources mention a category of Latin words where the singular and the plural are spelled identically.
Yeah, that happens in the Latin fourth declension. It involves words like plexus, which is a network of nerves,
Right.
or sinus, a cavity in the skull. In strict classical Latin, the plural of sinus is literally just sinus.
Wait, really?
Yeah, you would write, the patient has inflamed sinus, meaning both of them.
If I saw two sinus on a medical chart, I would just assume the doctor forgot to finish typing the sentence.
And that ambiguity is exactly why modern medicine quietly rebelled.
Good for them.
Yeah. Without any grand committee meeting in Switzerland, clinicians just started attaching the English E's.
So we say plexuses.
Right, we say sinuses. The classical Latin rule was abandoned purely for the sake of clinical clarity.
The old software was too buggy, so they forced a modern patch.
That's a great analogy. The same phenomenon happened in ophthalmology, actually.
Oh.
Yeah, the classical plural of the word iris is actually irides,
Irides. That sounds like iridescent.
because that is exactly the root of iridescent.
Oh, wow.
Yeah. But if you walk into an eye clinic today, no one is charting irides.
No, I've never heard that in my life.
They just say irises. The Latin form entirely lost the popularity contest to colloquial English.
Okay, here's where it gets really interesting, though. What about the word virus?
Oh, this is my favorite.
Because looking at the etymology in our dossier, virus is like the ultimate exception that proves the rule.
It is a brilliant historical quirk. In classical Latin, the word virus didn't actually mean a microscopic infectious agent.
Right.
It meant venom or poison,
Oh.
and grammatically it functioned as a mass noun.
Like the word water or mud. You don't say, I have 3 muds. You can't quantify it.
Exactly, you don't count individual units of venom. So because of that, the Romans literally never invented a plural form for the word virus.
It just didn't exist.
It didn't exist in their grammar. Fast forward to the late 19th century.
Okay.
Germ theory develops, virology emerges, and scientists suddenly need to describe multiple distinct infectious agents.
So they have this ancient Latin root word, but they look in the grammar dictionary and there is no plural code for it. What do?
They simply invented one, using English conventions.
They just made it up.
They slapped an "-ese" on the end and created viruses. It looks like it should be a classical Latin plural, but it is a 100% modern English invention.
I love that.
Yeah, they had to build a bridge over a gap the Romans never even encountered.
That is fascinating. The Romans didn't know about microbes, so they didn't leave us the grammar to talk about them.
Right.
But this friction, between ancient rules and modern usage, it isn't just a quirky history lesson. It is actively fueling a massive, unresolved debate in science communication today. Let's talk about the data war.
Ah, yes. The data war. This dispute gets to the very heart of prescriptivism versus descriptivism.
Okay, define those for us.
Sure. Prescriptivism argues that grammatical rules should be strictly followed regardless of how awkward they feel.
The rule is the rule.
Exactly. Descriptivism argues that language rules should naturally evolve based on how people actually speak and comprehend information.
And ground zero for this war, especially during the COVID-19 pandemic, was the word data.
Oh, absolutely.
We heard politicians, news anchors, public health officials constantly saying, the data shows.
Right.
Meanwhile, rigid scientific papers insisted on the data show.
Yeah.
Who is actually right?
That depends entirely on whose style guide you are bound by.
Okay.
Right now, we have two rival systems with massive institutional backing. If you submit research to a formal medical journal, you must adhere to the AMA Manual of Style.
Okay.
And they enforce the strict classical neuter plural we discussed earlier. Datum is singular, data is plural.
All right.
Therefore, the data are.
But isn't the AMA just being incredibly stubborn here? I mean, if 99% of the population treats data as a singular mass noun, like information or evidence, aren't the medical journals the ones failing at communication by clinging to an archaic standard?
That raises a really important question about precision versus accessibility.
Yep.
Journalists, on the other hand, operate under the AP style book. And the Associated Press recognized years ago that almost no English speaker naturally perceives data as a plural.
Because no one says datum.
Exactly. So they permit data to be treated as a singular noun, the data shows.
Okay.
Neither side is technically incorrect. They are just prioritizing entirely different values.
Right.
The AMA prioritizes historical scientific rigor and absolute quantification, while the AP prioritizes natural, frictionless public comprehension.
It's really fascinating how a single vowel, or just the absence of an es, can signal exactly what institutional team you play for.
It really is.
Yeah.
And it reminds us that medical terminology isn't just a passive dictionary.
No, clearly not.
It's an active ecosystem
Right.
where laboratory technicians have to clearly distinguish between a single index of measurement and a panel of indices.
Right.
If they miscommunicate that because they aren't sure which style guide applies, it delays care.
Wow. So what does this all mean for you, the listener, as we sort of zoom out and look at the whole landscape? We started with the ancient Greek observations of Galen and the Roman encyclopedias of Celsus.
Yeah.
We moved through the Swiss standardization committees of 1895, where doctors were so desperate to understand each other, they practically nailed these Latin and Greek declensions to the wall.
Rules that dictate the architecture of our charts today.
Right. Why we have 33 vertebrae. Why the lung has 480 million alveoli. Why a cancer prognosis literally hinges on the difference between metastasis and metastasis.
We saw the traps, too.
Yeah.
Like the sneaky X words that trip up radiologists and the quiet rebellions where we all just mutually agreed to say sinuses because classical Latin was just way too confusing.
But way too buggy.
Yeah. And of course, the fact that virus is basically a fake Latin word we had to invent to explain germ theory.
So cool. So you are now armed with the mechanical know-how to navigate this space. The next time you see a medical chart or read a health article, you'll know exactly why a word is shaped the way it is.
Yeah, and whether the writer is following the strict AMA legacy software or the colloquial AP update.
You literally have decoder ring for the underlying operating system now.
You do.
But I want to leave you with one final thought to mull over. We've seen how medical English absorbed and froze these ancient plurals over the last 2,000 years to solve a communication crisis, right?
Right.
But medicine today is changing faster than ever. It is dominated by modern technology, AI algorithms, and entirely digital acronyms.
It's a whole new world.
It is. As we move further and further away from the days of Roman anatomists, how will future generations handle the plurals of tomorrow's medical inventions?
That's a great question.
Will the rigid Latin system eventually be entirely swallowed by casual English? Will words like vertebrae and diagnoses eventually fade out, becoming nothing more than quirky historical artifacts, kind of like how astrology's ancient terminology still faintly lingers in modern astronomy? Will we eventually just slap an "es" on everything, returning to that comforting binary system we talked about at the very beginning? Something to think about. Thank you so much for joining us on this deep dive. Keep questioning the words around you, and we'll see you next time.